Hey guys, go get your percussion tool. If you don't have a massage gun, I call them percussion tools. If you don't have one, I kind of think you should have one. But if you don't, you can get a stick, so something that's used for self-massage. If you don't have one of these, you can also use a nice treated piece of wood or a wooden spoon or just anything that has a little bit of a safe, smooth, but firm edge to it, okay? So today we're gonna focus on using a couple of these tools to assist in our mobility. So remember, it's Mobility Monday, but we should be doing mobility daily, like every single day. When you do it first thing in the morning, you think you wake up hydrated, you don't. You wake up dehydrated, your tissue is dehydrated, so you've gotta get moving, right? So first thing we're gonna do is just gently move knee over toe, and it's very gentle. This session we're also gonna focus a little bit more on the lower leg, just nice and easy. So knee over toe, just kind of pumping a little bit of movement through the ankle, nice and easy. We're not too worried about what's happening above it. We're just moving through it. Good. Other side, knee over toe. Nice and easy. And you just want to find a gentle, comfortable rhythm with it. And good. Next thing we're going to do is we're going to stay in this full kneeling position, 2 knees down on the ground. Take your feet so they're slightly outside of your knees. It's going to put your hips in internal rotation. If you're following mobility and strength training for endurance athletes, you're really starting to understand the importance of hip internal rotation and your ability to get into the position, but also be stable and strong in that position. So heels and feet outside. We're just going to work through a hinge. So push your hips back, keep your chest up. We're getting a little bit of mobility through the knees, but not too much because of the full kneeling position. And we're starting to just move through high hamstring and pelvis, nice and easy. So just taking it through an easy hinge. Keep the chest up. There's not a lot of rules here. I don't want you to tuck your tailbone, nothing, just move. So we're just taking what you woke up with or what we're starting with. And then we're going to take the hands behind the head, elbows back, and we're just going to side bend. And you can do this from a standing position if you don't like being on your knees. But we want with that side bend to shift the hips side to side, right? So we're in that pretty much in the frontal plane here. Just drop the elbow, whoa, open the lat, open the hip, same thing other side. And you're getting a really nice toggling through the hip joint as well as you go lateral side to side. And the bent elbows here, just don't add as much tension or length or ask on the lats. So we're just getting started, nice and easy. Good. We'll take it into a half kneeling position and just move. So this is stable down low in the half kneeling, and we're mobile in the upper body. Keep your eyes on me, then we know we're really moving through the thoracic spine. It's gonna stop you when it should stop you. And then, so that was turning into the top knee. And now we'll turn away. Let your head go with this one. We're gonna take you a little bit further. And good. Other side. Keep that head forward. Good, and again, bent elbows, decrease intensity. This time we're turning away from the lead knee. Eyes are going with it. And good. All right, let's take it all the way up into a standing position. And from here, we're going to anchor the stance. Anchoring the stance means the fifth metatarsal is going to be parallel on each side. So again, it brings us into a very gentle hip internal rotation. Do not overcook this. Don't go into massive internal rotation. Just square up the feet. And from there, we're going to go back into a couple more hinges, but now we're including the ankle joint in the lower leg. Push the hips back, hands are on the hips, decreasing the amount of load or ask on the thoracic. So just nice and easy. Just push the hips behind the heels, and we're just gently starting to get more length through glute med, through lateral hamstrings. You can start to bring your knees in just a little bit. So as we rotate in with the knees, we end up getting a lot more lateral hip gentle length. If you smash something with a hammer or speed or intensity, it's probably not going to give us what we want. We want length, we want function. So you have to be patient in this process of getting everything online. So we know we're in a good position with our lower feet, with our hips, and we're just going to ask it to give us a nice hinge. Okay, good. Awesome. All right, from there, let's take the right foot behind the left foot. We're creating a length on that right hip, and we're not even going to go to hands behind the head. We're just going to gently lateral flex, lateral flex. We get a little TFL, we get a little glute med. Easy, easy. Head is in a strong position, no need to look down. Good. And then same thing other side. Left leg behind right. You're starting to feel a little bit taller as the motion comes into the body. Just nice and easy. Shift to the left. It's not unusual that one side will be tighter than the other. Good morning, Jackson. Come here. Come, keep going with those. Come here. Right there. Can you sit, please? There you go. You can be on TV today. Just stay right there. Stay, Jax. We've come a long way, Jackson and I. And good. All right, let's flex and extend the spine. And we're going to start that. Good boy. We're going to start that with your chin. So just chin down. Anchor your stance. So fifth metatarsal, parallel. And then we're just gently going to look up. Look down. Look up. Let's go ahead and take the hands, put them on the top of the glutes back here. Start opening the chest. You know, dogs always remind us how much better we feel after a run or some time outside, because this is after Jackson and I got out for just a nice easy 30 minutes this morning. Okay, now let's add the arms, the shoulder, the thoracic spine. So as the chin goes down, we're just going to reach to the knees, inside of the knees, and then we're going to come into that anatomical position and open up and let the hips go in front of the feet. Nice, easy for the spine. Start to find a breath pattern. There's no rules in this breath pattern. You can inhale here. Inhale, open. Start to work that diaphragm. Nothing too extreme, not too extreme. Just working through the upper part of the spine, asking it to flex with comfort and extend with comfort. We're not forcing anything. Let's go a couple more of those. 1, 2, 3. Okay, wide stance. Anchor your stance. Heels outside of toes. Just keep working that hinge. Push the hips back. And we're just going to tap the ground. So if you can get close to the ground, do it. If you need a prop, you can use a foam roller. Just touch the foam roller. You can always bring the ground up to meet you. But yeah, dogs, see how relaxed this dog is? He did have a very busy weekend. Took him to the lake yesterday, did a little swimming. Swimming is exhausting for him. He's got a lot of muscle, so he has a life jacket. Good. Easy all the way down. Now you're starting to feel high hamstring. And good. All right, easy one now. We're just going to stand with an anchored stance. So we're just going to keep working that same stance and just easy rotations. So everything we've spent the first 8 minutes of just gentle, easy mobility. Lack of stress in the body and just nice flow. Everything should feel open and start to feel confident, and then we'll get to work on things. Good and good. Down-regulating the nervous system to enhance movement. Now when we perform, we kind of need to upregulate. We need the nervous system kind of, in some situations and in most, we kind of need a little bit more on alert. So don't be thinking that we're asking to live in a sympathetic state or a parasympathetic state. It's a nice place to visit. You need to know how to get there, but you need to know how to access both. Okay, so we've got our percussion tool. We're going to work through the calf, and we're going to shorten the calf by bending the knee and just letting it be, this in itself, just being able to move your calf around like that, that's a percussion tool. But if you have your percussion tool, let's just work gently and feather through the tissue. Get some good blood flow. You can go down below it where posterior tib, soleus live. We're just going nice and easy with the percussion tool, down below it. Up into mid-calf. Good boy. And just feathering through that. Back side, right side, nice and easy. Good. Same thing other side, same thing. If you don't have a percussion tool, you can just beat it around a little bit. We're just working through the calf. Blood flow, fluid, and just kind of starting to let it know that we care about it. We want him to really work for us. It's midsummer. Dehydration is a big part of the conversation here. And we're just working through that calf muscle. I mean, talk about parasympathetic. Just nice and relaxed. It's nice to be around dogs sometimes because they can just teach us so much about state of mind. Okay, good. All right, next one. We're going to go through the big quad. Now, I like to put the quad on a little bit of an open hip position and just start to push the tissue away from the joint. So just nice and easy, comfortable position. Make sure there's no stress in the lower body and just push the tissue away. If you're using an implement or a harder tool, you're just going to stay in that same position and push away the tissue to try and create space and length through that hip joint. Okay, same thing other side, just nice, easy, open hip, and we're just pushing the tissue away. You can use a massage tool in a really effective, systematic way. So you have a plan. Leave it. I was wondering how long that would last. Jackson, sit. Sit, please. Sit. Good boy. Lay down. Good boy. Okay, so we keep that hip open. And good. Next one I like to do, let's work through the glute. So let's go left knee up. We're going to create a little bit of length in that glute. Use the percussion tool through a lengthened glute. And just give it a little bit of space. Now, when this one is going long, this left side glute is going long, what else is going long? Right side quad. So right there, after we go through the big glute complex, let's go ahead and work through a little bit of percussion for the soft tissue of the right hip. Left glute, right hip should be good friends. So just nice and easy. Good. And then we'll go to the other side. Right leg is up. Work through the glute. If you don't have a percussion tool, just do the movement. I guess what I'm trying to say is the investment in a percussion tool is probably good if you're not getting body work every week, and so few of us can afford body work every single week. So we've got to take personal responsibility for that tissue care. And this goes definitely to that category of tissue care and just taking the time. So right butt, left hip. If you have an underfunctioning right glute, your left hip might bother you. If you have an underfunctioning left glute, your right hip might bother you. They need to work together. There's this sequencing that happens between the right and left side in gait, whether it's pedaling a bicycle or running or hiking or whatever. So you definitely need to understand how they work together. Okay, from right there, let's go into a big old windmill. So the lower body should start feeling nice and relaxed and loose. Push the hips back just a little bit. When the right hip stops going to midline, the right shoulder's going to stop. This upper body's functioning like a box. So just nice and easy. Super simple things today. Nice and simple. Hip rotation, and I can feel my hip joints moving. One, it comes up, this one drops down, this one drops down, which means if my hips are moving and I can feel the hip bones actually doing this, my SI joint, I'm guaranteed, pretty much guaranteed, that it's gliding at least a little bit in the back. So just nice and easy. Rotate those hips in and out. Good. Shake that out just a little bit of stability. So when working through mobility, giving space with tissue care, we're just going to stand on lefty and grab that right knee. And all I want you to do is focus on that left pillar strong, left single leg stance. Work through the foot, and good. So stability without mobility can be tightness. We talked about that last week. Right leg, stand on right foot, grab left knee. And you're going to feel, you should feel unstable. You shouldn't be able to actually get here and just go rock solid. The best athletes in the world can't even do that. They work into it. We get better and better at it. But the blessing is that you can turn your systems off, that you can relax, and that you can be floppy and relaxed, right? Let's go left leg. This time we're going to grab both hands on the tibia. From there, see how forward I am, concave chest. Let's open the spine, get nice and tall. Through our entire lives, guys, if we can stand just like this, let the knee flop out to the side, two hands grabbing our own tibia, we're going to be pretty self-assured in life. Okay, right leg. This is the posture we're always after. Two hands, head is tall, pillar strong on the right side. Just standing nice and tall. You can feel how much work your foot is doing to just hold you in that position. Open the chest, and good. All right, let's go into a little bit of a split stance. We want to anchor this stance, so make sure that your back heel is lateral to the toes. Pull the hips off the ribs with a big breath. Just get tall. With your left hip back, we're just going to shift the upper body forward so that if there's a plumb line, my nose would be about 4 inches in front of my toes. And we're going to do that same rotation from a split stance. Internal rotation of your rear leg, dropping into internal rotation on the right hip by just dropping that left side into the right side. and we're gonna pump through that. We've used the percussion tool or some mobility to really wake that tissue up and let that tissue know it has to go long, it has to give us length. We want internal rotation on that right side. So we're gonna just keep asking that tissue to lengthen and trust that we have the strength and mobility to get there. All right, nice big breath, pull the ribs off the hips, tip forward, nose just directly in front of the toe, right hip to the midline, right shoulder to the midline, and we're just working through that. Nice, gentle, rhythmic movement. And that left hip, which is typically my hip of problems, doesn't light me up right now. My left hamstring's super healthy, but I do know that this side doesn't always give me the length I want. And when the length is, I don't get what I want, I end up with a piriformis that is in the on position pretty much all the time. And we want the piriformis to know he doesn't have to do that. He can just hold on, do his gentle job of stability, while the glute min, max, and med are doing their job. So it all comes in layers, guys. Thanks for spending this very simple, but hopefully a little bit of information that you can use throughout the week. Remember, this might even be the 200th episode. If not, we're getting very close. There's a ton of episodes. Use them all. Start at one, work your way through. But there's lots of good mobility. The philosophy stays very consistent. I don't flow with I'm just too old anymore. I believe what I believe. I'm open to learn. And I think we keep bringing good stuff to you. Have a great week. Aloha. Bye.